Well, first of all, can I thank you very much for asking me to speak here today. Some of you may have heard some of the things that I'm going to say before. If you have, I apologise to you. Bear with it. I'm sure there'll be some people in the room who haven't. I was appointed to chair the National Mental Capacity Forum, and we've been going now for 6 months. And I thought it was very important when we started off that we have the voice of the user that comes in, the real voice of the person. And so we started off with listening events, principally in London and Birmingham, but fed in from others around. And then those have been translated into some priorities for a leadership committee, where those people, it's a small number of people who've been working in the field for a time and who are change agents. And that group links to the statutory body heads group, so people like the Court of Protection, Office of the Public Guardian, Official Solicitor, Department of Health, Ministry of Justice and so on, and that's an implementation group, and I sit on that as well. But actually what we really wanted to do was find out what was happening on the ground, and so we've held the first National Mental Capacity Forum Action Day. Can I just ask, was anybody at that? Anybody from here at it? No? Well, you've all missed out, you see. It was an amazingly invigorating day with lots of projects of things that people are doing to improve the implementation of the Mental Capacity Act. Because I think basically I've been asked to do in 3 years what the government hasn't been able to do in 10. But I've also been asked to do it on 1 day a month, because that's all I'm employed for, and I have no budget. So it's just down to people on the ground, and I'm dependent on people on the ground sharing what they're doing. And it has to therefore be a movement. It's not a committee, it's not a committee structure, it just has to be about bringing about change. So what have I heard so far when I've been going round, and what has emerged? Well, a huge need for simple language. Lawyers manage to make everything simple sound complicated and scary, and they manage to make public awareness feel really scary, and lots of people run training programs on the Mental Capacity Act and make it really scary. They talk about case law and various things, and people go, oh, I thought I knew about it and now I don't understand. There are some really serious misconceptions around, though, and I think one that particularly hits in this area is the problem of next of kin and carers, and the role of carers. Because although at the end of the day, for the major best interest decisions, that may involve hospital procedures and so on, no, the can rests with the person taking it. Most of the time they are supporting decision making and taking the best interest decision over whatever it is with the person who has impaired capacity. And that capacity will fluctuate. And there's a lack of understanding about fluctuating capacity. So there's a view that you've either got capacity or you haven't, full stop. It's almost like an on-off switch, which you all know is completely fallacious. That's not the case. So there's a lot of work, I think, to do with really with relatives and with empowering people and stopping healthcare and social care being risk averse. There's an awful lot of, oh, we can't because I'm not allowed, or it's not in our policy. Well, that's a load of rubbish. Actually, guidelines are simply guidelines, and if it's what somebody needs to live as well as they can, then we should be helping that happen. And you come across crazy examples of that across the whole of health and social care. We'll address those another day. But some of the other things that I've found that linked with the role of carers and so-called next of kin is a problem over confidentiality. I think healthcare is particularly bad at this. They suddenly think, oh, we can't share information. And then they expect the person who is the carer or next of kin to carry the can for everything that happens. They expect them to know whether on a Saturday night at 11 o'clock they should be dialing 999, or it's something that could tide over till the morning, They expect them at 3 a.m. on a Sunday morning to know what to do. And if they haven't been given a whole lot of background information, when they phone up that dreaded 111 number, how many of you have phoned 111? How many of you have found it a deeply satisfying and helpful experience? Have I revealed my prejudices? I fear I have. Anyway, so we've got a real problem, a disconnect between so-called confidentiality and then actually dumping the burden on people who may be neighbours, they may be family members or whatever, but we expect them to do the care. There's also confusion around all these terms like advanced decision to refuse treatment and advanced care plans. And I would just like us to talk about wishes, refusals and plans, because people know what they want, they know what they refuse, and they know what their plans are. And advanced care plans is a crazy phrase because nobody's made a plan for what they're going to do last Christmas. They're always in advance anyway, aren't they? The other thing that I found really worrying was discovering how much financial fraud there is in the system and grooming and so on. And so we're doing a lot of work with the financial bodies, building societies and banks, who are often the point of contact. It's the cashier who will pick up that somebody's behaviour isn't right and may detect the grooming and the fraud. And what about the difficulties? Well, there are difficulties about the so-called least restrictive option, and at what point is it over-restrictive? The whole dolls area I'm not even going to touch on because it's a nightmare. But also communication difficulties. And the fact that for some people they lose speech, actual speech, before other things are lost. So they can get locked in a body. And at lunchtime I was talking to a speech and language therapist, and it's great that they're here, but there are not many of them around. But there's a lot of ignorance about the different ways that impairment can present and what that means. And just because somebody can't speak doesn't mean that they can't understand and that they can't express in a different way. So there is a problem about how do we get decision-specific capacity enhanced in people and support them. And if we're going to bring about change, somebody came up, this isn't my phrase, the sticky middle, and I thought it was absolutely brilliant. You've got lots of people on the ground, and particularly carers and relatives, who know exactly what needs to be done. And it's common sense and it's barn door. And you get lots of people, policymaker people like me, who are full of great ideas. Some of them you might throw out straight away and say, well, you think that's a great idea. I think it's a stupid idea, but fair enough. But you've got a whole group of people in the middle who, if they're going to bring about change, they have to change the way they work. They might have to carry the can for a larger risk than previously, and they just don't want to. And the phrase, the sticky middle, I think really explains some of the resistance to change that we keep on hitting, particularly across health and social care. And actually the Mental Capacity Act isn't that difficult. Can I ask you all to hold up your dominant hand, whether it is right or left? Keep it up in the air, okay? The 5 principles are really simple. Number 1, your pinky, presume capacity. Let's all presume everybody in this room has capacity for the decision that they took to come here today. Number 2, individuals being supported to make their own decisions. You would all expect to be supported in the decisions that you take. Now, if you have impaired capacity, you might need additional support, but that's normal living, isn't it? It's not something different and fancy. Number 3 is unwise decisions. Okay, you can put your hand down for a moment, but put your hand up if you've ever taken an unwise decision. Da-dum. The best one I heard, or the worst one I heard, is somebody who decided to try to detect a gas leak by lighting a match. Having blown herself up. A couple of years later, she did exactly the same again. Is that not unwise? Anyway, but then hands up again, because now you're onto your forefinger. That's the pointy one. Best interest decisions, okay? Who do you point to come in to make best interest decisions? The people who know the person best, and they're often not involved in the room. And your thumb is the least restrictive option, okay? And if you think about your pincer movement, those two, for people who lack capacity, that's where the power is. Those are the most powerful actions in your hand, and that's where the power lies in the act. Okay, lesson over. If you don't remember anything else, just think about your hand. It's not mine, it comes from one of the projects that we had at the Action Day. But I want to put a challenge to all of you about what are you going to do differently. Who is it who isn't getting the care that they should get now, and what are the barriers? I told you about some. And what are your personal fears to implementing change? And I think sometimes it's a really simple question. What do you want for your mum, or what do you want for your child? And I say child because how often are children in the circle of caring and support, and yet nobody bothers to explain to them what's gone on, and nobody tells them why the person does what they do. I spent some time with my grandsons explaining why people with dementia sometimes get dressed in a funny order, because they just get a bit muddled between their underpants and their trousers. But don't you sometimes get muddled with your swimming trunks? And they could kind of see it. And also, I think we need to think about the people who are out in the cold. It's fine to talk about those people with dementia, but they get other illnesses as well, and they get really badly treated. So heart failure, other neurological disease that comes along, strokes in particular, people who've already got learning difficulties, and then who deteriorate further, and the people who just go into the too difficult basket, or the people who end up on a trolley in A&E because they've gone wandering, or they've got knocked over, or they've fallen in the street, or something's happened, and they've been a scoop and run to A&E. And they are really left out in the cold because all the people who know about them probably aren't there. Or if they are and they haven't been included, they don't know about the heart failure because confidentiality has stopped people sharing information appropriately. So I think the most important thing when I look at all the problems that I've been hearing about and people write to me and tell me is that people haven't listened. Listen to the person and listen to the carer and listen to what they need. And that isn't just listening with their ears. This is the Chinese symbol for listening, and I think it says it all. Because you listen with who you are, with your eyes, with your undivided attention, and above all with this bit of you, your heart. And you listen to what's happening to people. Overall, the Mental Capacity Act seems to be a good piece of legislation. But when things have gone wrong, it's listening that hasn't happened. The worst thing that can happen, I'm beginning to think, is when things end up with case law, because it doesn't clarify anything. It means that some judgment gets gold-plated and rolled out widely. And is Dole's not an example of that? It's diverting lots of people and lots of money away from doing what they did before well. So overall, there are difficulties about those 5 principles. I'm not going to go through them now because of time. But I want to invite those of you that are working in the area of people with impaired capacity to think about whether you want to join the forum. Are you people who are making things happen? Do you have good projects, examples of innovations, and lessons learned from those projects that normally go in the graveyard? Do you know the ones that never worked and we don't like telling people about them? Well, please tell other people so they can learn. We will be having an action day again next year, springtime. We'll want projects in for that. But for those who want to join the forum, it is an honour and a privilege to be working with people like this, and we do have expectations. One, that you submit your project, what you're working on, to demonstrate that you really are a mover and shaker and bringing about change. That you are committed to furthering the principles of the Mental Capacity Act. Principles, 5 fingers. That you are committed to those principles. And you're committed to taking action, no matter how small, to improve the Mental Capacity Act implementation. We have no financial, we're not charging for membership. I've got no budget, so I couldn't even have the budget to process any money. But the sanction is that if we find that somebody actually isn't really adhering to that, isn't bringing about change, we will have the difficult conversation about, actually, I think your name needs to come off the list of members. But I would love us to have lots of people around the country by this time next year doing a lot. And our plan going forward is more the voice of the user, more supported decision making, looking at the neglected sectors such as prisons, increasing the number of people in the forum, and I'd have to say I'm very grateful to Sky because they are hosting on their website our work. Thank you. It's early days, but I hope you've all got energy. And I have to apologise to you. I can't stay for the afternoon because we do have things called votes across the way this afternoon on the housing bill. And I do actually have to go over to the Lords, and I've got quite a packed afternoon. So I'm sorry I won't be on the panel later. Thank you.